News reporter Macy Meyer has more details in our top story tonight. Macy?
Well, Bryan Health said they've been holding meetings since January on the progressing spread of the coronavirus and how it could affect Lincoln.
I wouldn't say there's a high level concern here. What we want is awareness. We want knowledge from reputable sources.
COVID-19 cases continue to rise all across the world, and the CDC now warning Americans that the spread in the U.S. is not a matter of if, but when. But how are local officials preparing if the virus comes to Lincoln?
We continue to practice our incident command scenarios, even if it's not directed towards infectious disease. How we respond is the same thing. We have the same structure, we have the same process of communication, making sure that we are aligning with how we've practiced before.
Members with Bryan Health said they've been meeting since January to discuss possible outcomes. If someone came to the hospital and was showing symptoms of COVID-19 and had a history of traveling to one of the 53 infected countries, they would be isolated and tested for the virus, something they've already had to do.
Very, very few. So people with known travel history. And so just on the side of caution, we did do that testing with the advice of the health department.
Thankfully, all tests came back negative. The mayor's office also reaching out to the public, reminding people to wash their hands and cover their mouths, even warning folks to have a 2-week supply of essentials such as food, water, and medication. With no confirmed cases in Nebraska, risk for exposure is still low, but health officials emphasizing it is important to be prepared. The Lincoln-Lancaster County Health Department now has a hotline for questions regarding COVID-19. That number is on your screen and on our website, klkntv.com. They'll also be holding periodic briefings, which will be held on Lincoln TV starting March 2nd.